So, Dr. Penny, do you prefer health care providers with the same cultural background as yourself or from a different cultural background? And why?
I think it's easier to deal with healthcare providers who have a common background like mine, because communication becomes easy, where you have people who understand where you're coming from and people who can appreciate some of the things you may not even be able to explain the way a person who doesn't know you have.
Okay. Yeah. Okay. And then what are some of your cultural taboos you have noticed in your country's healthcare system that we do differently here in America's healthcare system, such as pain?
For me, pain is a big taboo, especially among women. We grow up being told that you have to be strong, you don't go whining and complaining, and so that has become sometimes I find that disadvantageous for patients, because somebody may be suffering and actually going through some complications, but because they don't want to be seen as, fearful or weaklings, they hide their pains, and in that process we have actually lost. I think my concern comes from especially mothers bringing forth babies in a delivery situation where I have known a mother to die because they were having complications, they were afraid of saying it out. And so we have ended up losing mothers who really should not have lost their lives. Another one is cancer, where people have issues going on in their bodies and they're afraid of speaking out the intensity of their pain because I want to look strong. And then my frustration has been when somebody has been opened up by the doctors only to be told, I'm sorry, it's too late. You came too late. But they kept too late because they were afraid of being seen as weaklings.
Okay. So while at your residence, the primary language that you and your family speak is what?
My mother tongue is Kikuyu. But then we use what we would call our own national language, Swahili. And then we also use English, which is now predominant. So we use three languages: my mother tongue, our national language, which is Swahili, and then English.
Okay.
Yeah.
So, Dr. Penny, what culture do you identify yourself with?
I identify with different cultures, but predominantly the Black community, because that is where I find a lot in common with where I come from.
Okay.
We have a lot of things in common, and maybe because they came from where I come from, so there is a lineage there. But I'm also able to identify not necessarily with any color, but people who have basic needs.
Okay.
People who are struggling.
Okay.
And needing to be heard. Okay. I would call that more of a culture than a color or nationality.
Yes.
People who are needing to be heard, people who are marginalized, because that's what has been my fate in the past.
And do you find that when you identify with the Black community that we tend to wait till the last minute to go and seek health care?
That's very common. When I have done hospice, that's what I found out, that there is something very common with the Black community in ours, that we tend to do things our own way and we tend to try to manage what we have. Mm-hmm. At times not because we want to, but because of the resources also here, the availability of resources for this community where maybe funds are low. Mm-hmm. And they want to go out, but then they cannot afford. They end up in places like Cooper Green, where they have to wait and wait and wait. And I just as late as yesterday, I had a patient tell me that because I couldn't afford UAB, I went to Cooper Green. I was there for 18 hours. By the time I saw the doctor, I should have waited at home and just bore the pain. Mm. And that for us is very common, because we have to travel long miles before we can get to any hospital. So sometimes people have to choose, is it really going to make a difference? By the time I travel these miles and the whole day I'm traveling towards an emergency room, I might just as well wait and see what happens, which sometimes has caused us to depend on God
Yes.
for our resource.
Yes.
Yeah.
So what area or village were you born in?
I was born in Moranga. I was born in a rural setting, but came into an urban area later on in life.
So being in that rural setting, that is what you're saying about bore the pain and having to wait rather than sit in the emergency department for 18 hours.
So yeah, that may be equal to us having to travel, and normally it would be walking long distances. This person is hurting. There are many miles to walk before they can get to the village health center.
Okay.
Yeah.
And what degree would you say you identify with the chosen culture
With it.
of African American? What degree? I know you said that because of the healthcare settings with not having the resources in their environment, is that part of how you identify with the African American culture?
I do, because I also grew up in a colonized nation by the British. There were hospitals for the whites, which we couldn't attend. They could afford places we couldn't afford. And so, by necessity, our parents would end up doing herbal medicine, going into the forest and looking for leaves and roots to boil so that we did our own natural cures. So while the black American is missing out because they didn't have the resources, there was that segregation for us as well. We were not allowed into their hospitals, and they were not building hospitals for the black community for us as well. So there is that similarity in a very close way.
Okay.
Yeah.
The next question deals with the educational background. It says, how well would you say your educational background affects your knowledge of the healthcare delivery system in the United States?
It has a lot of bearing, because I have gotten through my education and through what I do today as a career, I am a lot more exposed to what is available out there, and yet my background also allows me to know that yes, it is available for the maybe 30%, but I come from that 70%. I know what I have missed growing up, and I know what my people are missing, because I know I live in both worlds. I have come from the poverty of most of us. I now walk and look at people who are in a different kind of a category, so there is that disparity, and sometimes it hurts.
And it's amazing to me, Dr. Penny, because you had said that the age you began going to school and the disadvantage that you had, and the history, what you said, that your father stood up and had to decided to make the decision to allow you to go to school. And what age was that, and can you go into that more for me, please?
I come from a culture where the woman and the girl child are more to be seen and never to be heard. And that meant that I grew up when girls were brought up not to go to school, but to do household chores in the family, in the community, and then grow up and get married and bear children. But there was something inside of me that didn't accept that. So when my brothers were taken to school and I was left to do that, I resented it, and I kept on pestering my parents. At the age of 11, they finally gave in. But today I know they did that at an enormous cost. My father lost his ancestral land. He was disowned by his clan, actually chased out of his community. And he had to transfer all of us out into, that's when we got out of my rural home into an urban area, losing everything, having to start afresh. And that for me is a great motivation, and it became my motivation all out throughout life, knowing what it took for my mother to move me from the normal African girl's life. It turned me into a trailblazer for other women. We became a bad influence, because we started a trend where other girls would demand to go to school, and so that's why we were kicked out of our community.
Is this in reference like what Oprah has done with the school that's in Kenya.
Exactly.
That's
Actually, the school is in South Africa.
South Africa.
It's in South Africa, but that is what she did to rescue girls who are condemned to just being little girls, grow up, get married, or whatever, have children, but no education was ever made. It wasn't important to educate women.
Okay.
Yeah.
That is so amazing to just know and have the opportunity to meet you and understand where you come from and to understand how important the educational system is, and then the culture of you having to come to adjust to America.
It's a humbling thing. I don't take anything for granted. I take nothing for granted because I look back and just like people out here have had to pay a cost for whatever, for whatever they have had to pay to rise up from the norm, from the common level, rise up into education, rise up for you getting into the nursing career.
Yes.
I guess that was not available for your mother or your grandmother.
No.
So there is a similarity there
It
that you also rose up from somewhere to become something, and that gives me a fellowship with the rest of you,
Yes.
not knowing that it didn't just happen, just like I had to fight my own battles. You have your battles to fight.
Yes.
And I take a lot of pride in what I see you people doing also.
Yes. Because having the opportunity to have this class, Transcultural Nursing, has allowed me to expand into not just my nursing, but to other cultures, to understand what it means to have health care for that person and then that culture. So that's the benefit and the opportunity that I'm allowing myself just by taking this course. It's the opportunity that I'm being appreciative, even to talk to you, and I work with you and enjoy your fellowship, like you say. So that's a blessing.
I think it also opens us up to offering holistic care.
Yes, and that's the main reason why we do what we do is for our patient the best outcome, so that they can receive the recovery that is necessary to make their lives better from diseases and sickness. So what learning style do you learn best, and how do you learn best with your educational background?
Of course, I do a lot of reading and I love writing. As you know, I have published some books, but I am more of an observer. I'm very hands-on person. I love watching what people are doing. I observe a lot of people's interaction. I also like to listen a lot. I am known to just sit and listen sometimes.
And sometimes just listening is the best observation and assessment that you can get.
Yeah, I'm open-minded to what is happening around me.
Okay, that is definitely how we have to be in today's society, open-minded. So how does this learning style allow you to make the choices necessary to promote a healthful lifestyle?
Listening and being open-minded to what other people are saying, be it patients, families, my colleagues. I think it is very important, because then you're offering, you're not just imagining what people need, but you're able to observe and give practical help. Actually being able to meet people's needs. And that calls for a lot of open communication, listening, paying attention to what people are saying. Because it's very easy for me to imagine and to think that this is what is needed. And when you listen, you end up finding that they are talking about a different thing. And then because of the cultural background where like I say, we want to be bold and I want to look like I know what I'm doing, it pays to pay attention, because some of it is they're unspoken needs.
Okay.
Which may be there, the underlying needs that they are not going to tell you, but being observant and being able to listen, looking at every cue, turns us into better healthcare providers.
And I like the last conversation that we had, that you said how the nurses weren't really meeting your need, and you had to go to your doctor and allow him to take the time to listen to what you had to say in reference to what you were going through and experiences. So
I think that's why I'm saying it is very important for me for each one of us as a healthcare provider, whatever discipline